And how does this agenda look at street level when it's delivered in an African community? What does it look like?
Right. So in the past, we had, when I was growing up in Nigeria, whenever we had to deal with donors or we had any contact with donors, it would look like this. A school is built. Children are able to get books thanks to a donor, a Western donor. Children are able to get scholarship thanks to a Western donor. Sometimes our donors would help to build a hospital or bring in a medical equipment. But that's not really the situation now, at least as far as my own travel, I have seen on my own travels. When you now go through the various African cities, towns, and villages, you would see sexual and reproductive health and rights projects that it will be thanks to the UK government or the Canadian government. Of course, in this particular case that we're interested in what the Canadian government is doing, particularly in African towns and villages. Just anecdotally, and even, anybody can verify the facts. There was a project that was started off by the Canadian government in Ethiopia. It's meant to be a nutrition program that is targeting adolescent girls. But when you read the fine prints of this project, nutrition program is meant to be good, right? Actually wrong, because you read this to see what exactly is this nutrition program going on in Ethiopia. It's actually the Canadian government trying to target girls by offering food, some kind of food program for children in school and out of school. But when they gather together, you find out that they are given the so-called adolescent-friendly family planning. So, and then it's comprehensive sexuality education. This is what our donors do that you will find is really insidious, really tricky. It's a horrible way of delivering things. If you have nothing to hide, and if you have the best of intentions, you don't offer food just so that you will then give what societies are rejecting. A lot of African parents and in a lot of African villages, they do not want strangers coming in to talk to their children about sexual matters, especially with the fact that how sexuality or intimacy is seen in different African societies is not the same way it is seen in Western societies. The Africans have a completely different way of viewing these things, different standards, the way they see family, the way they see marriage, the way they see their children as far as growing up and learning the morals, responsibilities, what is right and what is wrong. African parents want to teach their children all these things, and then the Canadian government then sponsors these projects that they then bring it in by saying they're offering food or they're offering nutrition programs. And when the children gather at school, away from their parents, away from their guardians, the Canadian government is sponsoring for these children to get this particular thing that has now already been conceived in Canada, ready to be delivered to African girls. There are also situations like some of the partners that Canada is right now just embracing so tightly, like Marie Stopes International, who I had mentioned earlier that they've been involved in so many scandals. But there was a point in time the Kenyans were rejecting Marie Stopes. This was actually just a few years ago when people were calling for the arrest of some of the Marie Stopes executives. Why? Because they realized that Marie Stopes went into schools, and the allegation was that Marie Stopes was giving contraception to children without parental consent. Now you wonder that an organization like this that is sponsored constantly by Canada right now, and Canada is one of the larger donors, is going into African countries and they are failing communities and they are causing outrage. There have also been cases where Marie Stopes has been caught or at least accused of illegal abortions in parts of society where abortion is illegal. There are also the different situations that we find that some of these organizations like International Planned Parenthood Federation Marie Stopes International, even this organization called IPAS that is also American, they are very much engaged in trying to lobby and advocate. And yes, even in some cases, we hear allegations of bribery occurring where they are trying to get to African legislators and African parliamentary members by offering them things, taking them to hotels, treating them well. Why? All because they are heading towards, pushing them towards the legalization of abortion. Where do they get that money from? They are getting the money from the countries, the wealthy Western countries that are sponsoring them. These are some of the ways that I believe that Canadian taxpayer dollars is going. So if you are a Canadian taxpayer and you are thinking that the money that you are giving that is finally ending up in foreign aid, if you are thinking that is helping some child in Africa have a decent meal or get a decent education, no, think more like your money might in fact be going to bribing government officials in African countries, parliamentary members in African countries, traditional rulers. These organizations, these so-called partners that Canadians or the Canadian government is working with, they are being strengthened by the money that they're getting from the government, and then they are wreaking havoc in some of the African countries.
Uju, Canada and the United Nations and other Western nations now regularly proclaim that abortion is a human right. Do you see abortion as a human right?
Absolutely not. But it's not even just what I see abortion as, or whether abortion is a human right or not. Let's just look at the African continent and how the African countries view abortion, and why, for example, it has been such a problem, even for those who are lobbying for abortion. It's been so difficult for them to make headway in African countries. I had mentioned earlier that some of the beliefs that the Africans have, or different African countries and communities have about abortion, go right back to cultural views and values. A lot of the African cultures, for example, believe in, the bloodlines, that I am the product of my ancestors and I carry the blood forward of my ancestors. So imagine how societies like that believe so strongly in the fact that we, in the present, we are connecting the past to the future generations. So the past generations to the future generations through the human life will then completely reject abortion, because you see that as a break in that kind of blood lineage. The Africans also believe so strongly in the fact that the baby in the womb is already alive. The baby in the womb is human, even without the benefit of science, even without ultrasound. I see and hear this among people who have never seen an ultrasound, who cannot afford to do an ultrasound, but they already talk about their babies as if their baby is very much alive. We name our children sometimes before birth. We also have names that reflect the beauty of life, the gratitude that the family or the parents of this child and the grandparents of the child have about the baby being alive, about the baby's, the grace and the hope that the baby is bringing. So even with all the difficulties that people may be going through, there is such a high value that is attached to the human life. So we have continued to reject this idea that abortion is in any way a good thing. Abortion kills. Abortion is an attack of the most vulnerable. This is not just my view. I am talking about the view of the community where I come from. Now imagine that entire nations are thinking this way. And so we then come out to the world stage, the United Nations, where definitely the Western countries continue to bring up the fact that abortion should be a human right, a universal human right. But the African countries and other countries continue to reject this idea. No, abortion is not a human right. Abortion is not in any way universally accepted. As a matter of fact, there are more countries in Africa that reject abortion outright than those that accept it. There are about 4 countries in Africa that have what you call abortion on demand. The rest of them are saying no to abortion. Even when people try to bring in abortion, the so-called abortion rights through one way or the other, people keep rejecting it. So no, abortion is not a universal human right. It has been rejected many times. The idea that abortion could ever be taken as a human right is not a new thing. We've heard it before. They keep bringing it up every time at the United Nations, and every time in the same way it is rejected. So the fact that Canada has that view, it should actually not affect the way they treat African countries that have taken a completely opposing view to it. And as a matter of fact, whenever anybody comes into an African country and sponsors abortion or anything that has to do with abortion, this is the way it is seen by society, that country, that Western country or that Western donor is spending money trying to find ways to kill our younger generation. That's the way it's seen. And that's the way that I have always known it. That's the way that a lot of people think about it. And that is our policy position anyway.
Uju, you mentioned poverty as a factor, and that gets us back to, I guess, the most important question. What should we be doing instead of promoting abortion, foisting abortion, changing African culture to normalize abortion? If we really wanted to help women and girls in Africa, how could we be spending our money better?
I will be so biased to say that education is the way out of poverty. It is the lifeline. It is what people know in African countries. Everybody or most people want to go to school. Most people want to get better training, better education, so that they can actually live and support them, live on their own and support themselves and support their families and bring their families out of the clutches of poverty. We want better education, and that is the one thing that is lacking across the continent. The UNICEF puts out numbers every year of the number of children who don't have access to education, children who should be educated and they're not being educated. And in the African continent, every year, consistently, we are having the highest number of children who should be enrolled in school and who aren't getting educated. Children who are even of primary school age. Once a child is at primary school age and is not getting any kind of education, that child is set for poverty for life already. Talk less of the secondary school and, of course, trying to get people into higher education that can then get them the skills they need to get gainful employment, to get themselves out of poverty, to get their families and support their families out of poverty. So anybody who is of goodwill and who wants to help any community in Africa, you want to see them thrive, you want to see them not dependent on your aid, you have to offer them education. You have to offer them a better way or an easier way for their children to get into school, and that is where our problem lies. Then, of course, with education, you have a few other things that will make our lives better, like healthcare. We have to be alive to be able to get educated, so helping to strengthen our healthcare system and our healthcare facilities and institutions, getting the judicial systems working, getting the law enforcement systems working so that people are actually safe within their own communities, trying to get rid of terrorism in the African countries. As people who follow the news may already know, that in different places, like in my country, we have had problems in more recent years of terrorism. How do we get out of all of that and be able to stay secure within our own communities and be able to thrive within our families and be able to stay healthy and then pursue education and pursue training? That's all possible, but it will only be possible if the international community is keyed in with us or is tuned in and listening to exactly what people within those communities want and what they are asking for. Abortion is not the way people. In fact, many Africans turn up their noses when you tell them that, some Western country has made this large budget for sexual and reproductive health and rights. People wonder, well, can they see that we don't even have food to eat? Who is talking about sexual and reproductive health and rights? But it's interesting that our Western donors, many of our Western donors have already made their priorities, and because many of them haven't lived in our towns, our villages, our countries, they have no idea whatsoever what it is like, being a little child in an African city or in an African village or in an African town. And then, of course, they have absolutely no way of reconciling what life is like in an Africa, living in Africa with trying to get out of poverty. And I think that's what really leads them to this point where they're offering us all these things that we haven't asked for and that we don't want. And many times we reject, by the way. So it's almost like an exercise in wasting money, that if you are bringing sexual and reproductive health and rights to a community that hasn't asked for it, the most likely thing that will happen, as we've seen happen many times with regards to many of the African projects, is a waste of money, is that nobody takes it and nobody accepts it, but that money is already spent and it's taxpayers' money. What Africans really need and what we continue to ask for is good education, and not the so-called comprehensive sexuality education. When it comes down to it, what the Africans are always asking of and always asking for is safe delivery of their babies, and not the so-called safe abortion. So what the language that has already been set out in the West, what it tells us is not always, in fact, most times is really not what the Africans are asking for.
Uju, when you said that Africans aren't excited by our abortion agenda, that led me to wonder, well, who is excited by it? Because governments wouldn't go to the lengths that our government has gone to talk about it, to promote it, to mention it in every announcement. Recently, for example, Uju, I noticed that we had an announcement about Canada's aid to the developing world for the pandemic. And sure enough, even in that announcement, we were talking about help fighting COVID-19, there was a reference to this agenda, this so-called maternal health agenda, which is really the abortion agenda. And I wonder whether the demographic that gets excited, the community that gets excited, is back here in Canada. That the government isn't, as governments sometimes do, pitching its aid agenda to a group that it's targeted at home. And that maybe a big part of the education is not just for aid professionals, but for Canadians too. That we need to think much more carefully about what's happening in Africa, the consequences and unintended consequences of Canadian assistance.
Right. So what you had referenced there, the COVID-19 relief fund that the Canadian government had joined with, I think, 59 other countries to make a statement about COVID-19 and COVID-19 funding. It was so telling. It was so telling as to who is excited. Who's excited about sexual and reproductive health and rights? Who is excited about easy access to abortion? That at a time like this, in this year where there has been a pandemic, many more people have tuned in to see what's happening around the world. How are people responding? How is your own country responding to this? People have had to, take account of what we have, what any country has, in order to be able to live through a pandemic like this. From the very beginning of the COVID-19 pandemic, many countries had to count again to know how many ventilator support systems do we have in our healthcare system, for example. How many intensive care units can we have and support in this country? Because, of course, many people who were in a bad situation with coronavirus had to be admitted into intensive care units. At that point in time, David, that was when we realized that there are, in fact, up to 10 African countries without a single ventilator system that could support somebody who needs the ventilator. We found out that there were many African countries that didn't even have intensive care unit or any way to support people who need ICU care. So at a point where the incredible gaps within our healthcare system got exposed, in this year there has been a pandemic, people are coming out to talk about sexual and reproductive health and rights. The Canadian government cannot be serious about this. It's unbelievable, and what a shock. But also it's quite telling as to what an ideologue does, that at a time when the world is prostrate on the floor trying to struggle to survive, that someone will be talking about sexual and reproductive health and rights and how more money should be put to it.